Iain, you've received this petition today about the minor injury units. There's clearly concern that there is a plan to close them. What's going on?
So, yes, we've received the petition from the St Austell and area Labour Party today around their concerns around closure of minor injury units. There are no plans to close any of our minor injury units, and we reflected in governing body today about the communication around that earlier in the year and about how people have misinterpreted what those intentions are or were. What we most certainly want to do is to ensure that we've got the right out-of-hospital urgent care service. That will include people being able to look after themselves, be able to use local pharmacies, minor injury units and minor injury services provided by GPs, urgent treatment centres and emergency departments. What we're really clear about is if there's any change to the configuration of a service, we absolutely, as a healthcare commissioner, have to go out to public consultation.
You say that there are no plans to close the minor injury units, but back in January, your own organisation published a management report talking of your commitment to replace them with urgent treatment centres. Well, that sounds very much like a plan to close to me.
It isn't a plan to close, and when we made comments and statements at that time in January about the misinterpretation of those words, we want to be able to upgrade some of our minor injury units potentially to urgent treatment centres.
Let's just clarify that. So there is no commitment to replace minor injury units?
There is no commitment and no formal plan to close minor injury units. That's absolutely what was said in governing body today, and I absolutely stand by that.
Well, let's look at Saltash and Foy, where there are minor injury units, which have already been closed with no public consultation whatsoever. Now, you're going to tell me that those are only temporary closures. Those are temporary closures which have now run for more than 2 years.
So those are closures again by the provider when they've been unable to sustain a local service, and one of our most pressing issues here in Cornwall is workforce and being able to recruit the right numbers of people to be able to provide the service for the needs of a population, and we have to use that workforce to its best effect. And our provider, in consultation with us and speaking with us around how they configure services, felt that wasn't the right thing to do. We have not closed permanently those minor injury services. We very much have to have a minor injury service, and I'm not going to get drawn back into that argument again.
No, but I mean, Foy Hospital, for example, you say it's only temporary closure. Architects have already drawn up detailed plans to turn it into a residential nursing home. At Edward Hain, for example, there are detailed plans to turn it into accommodation for nurses. They're not coming back as hospitals, are they?
So what we're asking our communities to do is to think about what does their population need, and to think with the resources they have about what they might be able to do with that. And the work you refer to in Foy and Edward Hain is part of that work where people are looking at what they can do. We haven't, and again, that work has not been led by ourselves. That's by the provider themselves has looked at their capital estate and what they may be able to do. But before any service can change, then we have to understand what does the population need.
Wouldn't it be a good idea to ask people before we spend money on architects?
We haven't spent money on architects.
Well, somebody has.
The CCG has not spent money on architects.
The Health Service has spent money on architects, and nobody has been asked for their opinion.
I think that the provider, the current provider of that hospital has been in consultation with the local population, particularly in Foy, and they have a very active group, certainly down here in the west of the county. The people talking about what we may be able to do with Edward Hain, and people are very committed to getting the best out of the local resources and services that they have.